right, how are we doing? Let's see. Last question for the day. It's from Mark. Hello, Mark. Yeah. All right. So I read the news release that China recently released stating that the city of Wuhan tested almost 10 million residents and only found 300 new positive COVID-19 cases. None of these 300 exhibited symptoms, asymptomatic, sweet, and none of their 1,000 close contacts tested positive. If this is true, it would seem to indicate that asymptomatic transmission is more rare than originally thought possible. But those results almost seem too good to be true. What's your conclusion? Yeah. My conclusion is that this is interesting, this is positive, and I'm glad they caught those 300. I don't know about the asymptomatic transmission thing. This is another data point, and there are data points showing that it can happen and data points showing that sometimes it doesn't happen. And so it may well be, we're just trying to figure out, so if you're asymptomatic but you have the virus, probably, I think, you would have lower amounts of virus. Now, I need to go and check this. The few papers I've seen that actually have viral loads, the data is just a mess of kind of crisscrossing lines, and it's kind of hard to tell, viral loads on, sort of high symptom patients versus low. But normally the way these things work is that the sicker you are, generally, the more virus you have inside you, and the more virus you have inside you, the more likely you are to be able to transmit it to somebody else. If you're asymptomatic, the idea is that your body is probably controlling the virus to some extent. And so it's like you could pass it on, but the odds are going to be a little bit lower, is what I would guess. But this is all total guesswork, and I need to see some papers on this. And so I'm going to go and look, and I'm going to let you know what I find. This is, like you say, this is good news. Also, like you say, this is probably a little too good to be true, because there are situations where it definitely appears that a person who did not have symptoms was able to spread the virus. And so, yeah, we got lucky 300 times, which is pretty good. 300 coin flips all land heads up. You'd say, wow, that's a little more than a coincidence. And so there is some science here, I would not doubt. There may also be a little politics here as well. But what I really like is this idea of going in and just testing everybody. Just like, hey, everybody, let's have a little test. And that's the way that we root out the last cases. And that looks like what they're doing there. And this is what everybody in the world is going to have to go through at some point. We're all going to have one or more of those dumb little Q-tips shoved either down our throat or up our nose in the name of trying to get rid of the last bits of COVID. We're still a long way from there, to be honest. Yeah. But, what we're talking about is kind of end game stage. And, can't get there soon enough for me. But we've got a lot of work to do in terms of lowering the amount of cases before we can even think about anything like that. We could do it now, but we just have to test everybody in America and then retest everybody in America a couple weeks later. And we would probably find hundreds of thousands of cases minimum, and you may well find a couple million cases if you manage to do that. And so, yeah. But even though, imagine you're in charge of a country, or you're just a politician in general, it's going to look bad to people that don't really pay attention to things, that you're finding all these cases all of a sudden. It's going to look like a massive spike. But you just got to go in there and explain that this is the amount of virus that was already there. We are detecting this. And once we've detected it, and once we've got everybody into some kind of quarantine or isolation or treatment or a hospital, then it's not going to spread anymore. And yeah, that would be taking the biggest possible chunk out of the total number of COVID cases in the world. And I'm in favor of that. Moves like that are what could get us out of this soon. But yeah, that would be expensive, and I know there would be a lot of people very reluctant to do anything like that. But that's exactly the kind of thing that would have maximum return on investment, if you like. in terms of helping to get rid of the virus. So thanks very much. Very good question. And thanks. This has been Ask Dr. Ben.